This is an example of the shock absorption of the lumbar spine or the lower back. Notice in the blue structure, which is the disc, notice the nucleus in the middle, which acts as a pivoting mechanism, and this video is cycling through different degrees of thinning of the disc. So it shows you how the disc is prone to breaking down. This training is going to be teaching you how to keep this from happening or minimizing the breakdown or loss of the disc thickness over time. So remember, our goal is to minimize the thinning of the disc nucleus. See the little nucleus in the middle of the blue structure? Once that weakens, it begins to press to the back. Now the spine is showing the links called the facet joints, and they're prone to becoming irritated, called it facet syndrome. We're going to look at ways that we can preserve the thickness of the disc and keep it from thinning over the course of one's lifetime.
This is an illustration of the normal disc between the bones, a bird's eye view, so to speak. The disc is very much like a sawed-off tree trunk with circular rings called the annulus fibrosus. In the middle is a pulpy type material called the nucleus fibrosus. The spinal cord runs down the middle of the spine with a pair of nerve roots running on each side. Typically the disc has the potential to tear anywhere around these fibers. Most commonly it's going to tear in this direction, what's called posterior lateral, which is the path of least resistance where the nerve root is. If you'll watch the right side, you'll see an example of a disc that herniates and comes out through weak fibers over time, hitting this nerve root. Watch the right side. As you can see, the disc has become weak, creating pressure, hitting this nerve root. This nerve root running down an extremity would tend to cause radiating pain or numbness radiating into the extremity, such as the arm or leg. If this fragments, which we'll click here, you'll see how this fragment shows the nuclear material coming out, hitting the disc, hitting the nerve root and becoming even weaker. This is an example of something that might require surgery if it's this weak. Normally, this can also happen toward the middle, as you can see here, hitting the nerve root and the spinal cord in the middle, potentially affecting nerve roots going down both sides. Now we're going to show how this also can fragment, as you can see here. That fragment makes it weaker and potentially something that might require surgery. Normally we like to have a nice, smooth disc that's consistent all the way around with plenty of breathing room where the nerve roots are going out both sides.
Looking at the disc from the side again, notice the little green area. That's where the nerve root exits. If the disc is weak, the bone can settle down and back. Thinning of the disc causes a compromise. If you look at that green area, see how the bony material starts to encroach on that area where the nerve root is. So we're starting back fresh again. Little by little, degeneration can press on the nerve. So not only can the herniated disc irritate the nerve, but also you can have a stenosis or a crowding effect of the nerve root. When that crowding effect sets in, it's very difficult to relieve pressure from the disc. This is showing a gradual degeneration, more and more and more, a thinning, which then compromises that little green area when that's where the nerve root is. So sciatic pain going down your leg can come from the disc pressing on the nerve and or the bone slipping back pressing on the nerve. Either way, the disc has to weaken, and that's what causes the pressure on the nerve and then down the leg. Next, we're going to look at how muscles move bones. When there's irritation, the muscles will respond by tightening up and compensating. When there's irritation, the muscles tightening will shift the spine from side to side. If you have an imbalance over a long period of time, you can have your shoulders and your hips shift as the body compensates. The body is such a powerful compensating mechanism. You can see, especially down the lumbar spine, notice the facet joints, how when they come together they link together. If there is fixation between the joints or a disc problem, you see how the hip will rise or shift in compensational movement in order to take the pressure off and balance as much as possible in the lower back. Chronic muscle tension and spasm is a result of distortion and uneven weight-bearing load in the lower back.
Normally the spine should have a straight alignment from the neck down to the tailbone. We analyze lateral curvature of the spine called scoliosis, which is demonstrated here. when the vertebrae become fixated, stuck, kinked, or out of alignment, the spine can distort into a lateral curvature. We have many different ways of analyzing the various angles of scoliosis, thereby determining the degree of misalignment. Normally, we like to preserve proper alignment of the spine. Even when a patient has genetic predisposition to scoliosis, we find that proper tone of the muscles and proper alignment and proper segmental movement of the individual bones of the spine can minimize this scoliosis tendency over the course of a lifetime.
In review, this is the shock absorber video clip I want everybody to learn about. Always remember, the blue structure is the disc. The structure in the middle of the disc is the nucleus pulposus. That's the pivoting mechanism that's also part of the shock absorber system. Our goal, by teaching you all of these lifting techniques and habits, is to preserve the thickness of the disc. If you allow micro tears to happen between the bones in your spine, you're going to have an inordinate amount of breakdown of the thickness of the discs, and in the long run you're going to be more prone to having pressure on nerves, irritation of the joints of the spine called facet syndrome, compensational muscle spasm, muscle knots, chronic pain, and disability. That's why it's so important to pay attention and learn about the little details on how to take care of your spine. Thanks for watching.